Hello everyone, good morning and hope you're doing good. Today we are going to discuss about mental health team. Who or all will be there in a mental health team? Before going to the topic, we will discuss the quote as usual, and today's quote is: coming together is beginning, staying together is progress, and working together is success. So, if we work together, definitely we will get success. So, come together, stay together, and work together. So, teamwork is very important to provide better result, to get better result, to provide better care, better service, better life. So come together, stay together, and work together to get success. And what is mental health team? Mental health team include a group of professionals to provide mental health support to people. They will work with us to improve our mental health. Mental health team will provide physiological, psychological, spiritual, social, emotional support to the mentally ill people. At the same time, they are working together to provide awareness to the people regarding the importance of mental health and well-being. So, mental health team is there to provide awareness to the people regarding the importance of mental health and well-being. Now we will see who all will be there in the mental health team. They are psychologists, psychiatric nurse, registered psychiatric nurse, clinical psychologist, psychiatric social worker, psychiatric nursing aides and attendants, psychiatrist, occupational therapist, recreational therapist, play therapist, art therapist, counselor, social worker, clerk, and registry worker. So these are all some members we can see in the mental health team. They will work together or one or two from this group or all together. They will work together or one or from, depend upon the situation, will work in the mental health promoting area to provide better care to the mentally ill person, as well as to provide awareness to people regarding the importance of mental health and well-being. First, we will see who is a psychiatrist. He is a doctor with post graduation in psychiatry with 2 to 3 years of experience. Minimum 2 years experience is needed to work as a psychiatrist. So he is a doctor. After MBBS, he'll take specialization in psychiatry and he will take training in psychiatric field, and he is a psychiatrist. And he will do diagnosis, treatment, they'll prescribe medication, and also they will be a part of whole care from head to foot of the patient. Next, who is psychiatric nurse? Next to psychiatrist, we can see a psychiatric nurse. The psychiatric nurse have master degree in psychiatric nursing. She takes responsibility in treatment, prevention, and therapy. She also involving in the whole process from starting to end of the care process. Next one is mental health counselor. Of course, counseling is a major part, or counseling is playing a major role in mental health program or mental health welfare planning. So mental health counselor provides counseling. They need license to work as a counselor. That's very important. So they need a license to work as a counselor. Simply, no one can keep counseling. Okay, in an established institution, a counselor is sitting means definitely he or she need a valid license in their hand. There are different type of counselors we have. They are like marriage counselor for marriage problems, family problems, and addiction counselor. Already in the terminologies we have discussed what is addiction. Over dependence on something, might be alcohol or might be psychological or physiological things. So regarding that, how we will overcome all the things, will discuss addiction counselor, then family counselor. So marriage counselor, addiction counselor, family counselor. So these all counselors will provide counseling. Okay, through their conversation they will find out the problems of the patients. That's what they need license, of course, to work as a counselor. Then next is social worker. Social worker, from the word itself you get the meaning. Social workers are dedicated employees and they are ready in helping people to cope up with life problems. Okay, they will try to enter into the life of people, and they will enter into the middle of the society, and they will find out the problems, and they will help with people, or who the people who is struggling with substance abuse, child abuse, unemployment. Okay, like core problems. Okay, they'll find out the problem and they will help the people, those who are struggling with this kinds of addictions, abuse, unemployment, etc. And they are categorized into different groups such as family and school social worker. Their specific focus is on family and schools. Okay, then public health social worker, in the normal community they will work. Mental health social worker, they'll focus basically on mental illness and people those who are staying in the old age home and that areas. And substance abuse worker, that means those who are addicted to any kind of substance, that's mean addicted people. Okay, so these are all the type of social workers. So social workers are dedicated employees and they are ready in helping people to cope up with the life problems. Okay, these problems, life abuse problems, unemployment problem, okay, substance abuse problem, school, family conflicts. Okay, everything things are the daily day-to-day life problems. So social workers are dedicated employees and they are ready in helping people to cope up with life problems. Next team member is registered psychiatric nurse. Then from the word itself you will get the meaning, registered psychiatric nurse. After psychiatric nursing diploma or degree, they need a registration, a valid registration, and they are involving in all process from the admission of the psychiatric patient in the hospital till the discharge, and sometime in the rehabilitation process also they will be participating. Next is psychiatric social worker. Okay, psychiatric social worker means after psychiatric nursing some people will go for social work, that is psychiatric social worker. They also, what they're doing means they need a postgraduate degree in social work, and they will help in admission, discharge, planning, vocational training, therapies, rehabilitation, etc. Okay, these are all the other two members we can see in the psychiatric what or mental health team. Then occupational therapist. Okay, they have specialized training in occupation therapy and they will help in the patient to develop some skills to do some jobs. Okay, they will help to learn some jobs, to do some jobs after coming out from the psychiatric hospital. Okay, and apart from that we can see music therapist, art therapist, psychoanalytic therapies. All these therapies I have discussed in previous videos. Please watch this video, then you can understand how these therapies are working to help the mental ill persons to overcome the mental illness, and also how they are giving awareness to lead or live like a normal human being in the society. Next, or other para professionals. Okay, now we have discussed about the health professionals. Okay, now para professionals also working. Okay, they don't want direct medical or nursing or a health degree and all. Okay, from the general courses they can enter into the health team. They are psychiatric nurse assistant, they will assist the psychiatric nurse. Then ECT technician. Okay, they are also a part of thus mental health team. Sometimes the mental ill person need ECT, electroconvulsive therapy. In that case ECT technician is going to be a part of mental health team. Then helper to do all the works. Then housekeeper to maintain the hospitality in the mental health center. Okay, housekeeper. Then psychiatric nursing aides. Okay, these are all the other para professionals we can see in the mental health team. Then very important person, psychoanalyst. Okay, they are trained professionals following great psychiatrist theories to deal the mental health strugglings of the people. Okay, after diagnosing the problem, okay, the doctor will suggest you go to this psychoanalyst to take the treatment, to take the therapist. So then the therapist will start to act. Okay, they will teach the patients to overcome the struggles. They will help in different therapies, such as there are a lot of therapies are there, like psychoanalytical therapy, behavioral therapy, cognitive behavioral therapy, family therapy, group therapy, milieu therapy, recreational therapy, art therapy, like so on. Lot of therapies are there. All therapies already we have discussed in previous videos. Please watch that videos. I will give the link in the description box, then you can understand how the therapy is working. So psychoanalyst is the person who is teaching the patient to overcome the struggles. They will use different methods, different techniques, different sessions they will take to understand the problem and how they can overcome the problem, how the mental ill person can overcome the problem. They will teach everything. Okay, so that's the work of psychoanalytic. So she or he is playing a major role in a mental health team. Next is MDT. MDT means what? Multidisciplinary team. That means all together working together, or working means that is known as multidisciplinary team. So mental health team is otherwise known as multidisciplinary team, and all the members working together and they will work together to provide maximum care to the people. So this is about the mental health team. Okay, so in the mental health team a group of people are working together to provide better health, especially mental health, spiritual, psychological, social health to the mentally ill people. At the same time, they will help in providing awareness to the common people regarding the importance of mental health and mental well-being. Hope you understand. Thank you.